Have you ever caught yourself noticing little shifts in the behavior of someone you love, small things that seem like just another part of getting older? What if these changes are more than just the passage of time? What if they are clues, silent messages from the body, signaling that the end of their journey is closer than we realize? Aging isn't just about gray hair and wrinkles. It's a complex process where the body whispers its final goodbye long before it's obvious. But here's the catch. Most of us don't notice these signals until it's too late. And by then, there's nothing we can do but look back in regret. In this video, we're uncovering 5 subtle signs that often appear in the final year of life. Signs that, if we catch them early, can change everything, giving us time to truly prepare, reflect, and ensure our loved ones' final days are filled with comfort, peace, and love. This isn't about fearing the inevitable, it's about understanding the body's final message so we can be there when it matters most. Stick with us, because recognizing these signs might just give you the clarity and peace of mind you need for the road ahead. You'll never look at aging the same way again. Let's dive in. Sign 1. Significant weight loss. At first glance, weight loss in the elderly is often seen as an inevitable part of aging, something that simply happens as we grow older. It's easy to brush it off, thinking it's just part of the natural process of life's later stages. However, when this weight loss is unintentional, it's often a sign of something much deeper and more concerning. It is essential to pay attention to these subtle, often overlooked signs, because they may be the body's way of sending out distress signals. One of the first things that can happen is that the body's ability to absorb nutrients starts to decline. This can be due to a variety of factors, such as a slowing metabolism or weakening digestive functions. As the body struggles to absorb nutrients properly, it starts to lose its ability to maintain muscle mass, which leads to muscle wasting. This isn't just about the outward appearance of losing weight, it's about the weakening of essential muscles that provide us with strength, stability, and the ability to carry out basic tasks. Muscle wasting is particularly dangerous because it doesn't just make movement harder, it compromises vital functions, making falls more likely, weakening the immune system, and leaving the body vulnerable to infections. These aren't just cosmetic changes, they are the body's way of signaling that something is wrong at the most fundamental level. Unfortunately, many families try to combat weight loss in elderly loved ones by encouraging them to eat more, offering their favorite foods or supplements. While well-meaning, this often overlooks the deeper issue. The body, as it begins to shut down, may simply not be able to process food the way it once did. In such cases, no matter how much you push them to eat, it won't make much of a difference. It's not about the quantity of food, it's about comfort, hydration, and giving the body small, easily digestible meals that require minimal effort to consume. Sometimes, the key to handling this phase is to shift our focus from force-feeding to providing comfort and support. Hydration becomes just as important, if not more so, as maintaining a diet. Offering small, easy-to-eat meals that nourish the body while respecting its limitations can make a world of difference. When the body is in this stage, it's not about treating the symptom of weight loss, it's about caring for the body in a way that respects its natural decline, ensuring comfort during the final stages. I vividly remember a case from my years of practice, a woman in her early 80s who lost a significant amount of weight over the course of just a few months. At first, her family assumed it was just a part of aging and tried to get her to eat more, offering her favorite foods like rich stews and hearty dishes. They pushed her to eat protein drinks and supplements, hoping that she would regain the strength she had lost. But despite their efforts, her weight continued to drop, and her once vibrant personality began to fade. After examining her, it became clear that her body could no longer absorb the nutrients from her food effectively. It wasn't that she didn't want to eat, it was that her body's systems were gradually shutting down. Her ability to process proteins had diminished, leading to rapid muscle loss and a weakening of the very structures that had once allowed her to be active and independent. Her family, though caring and devoted, were so focused on getting her to eat more that they didn't fully recognize the deeper issue her body was preparing for its final transition. They had been offering her comfort foods, but there was still an underlying resistance to the reality of what was happening. The reluctance to accept her body's natural decline led to frustration and heartache. It was only when we shifted our approach, focusing on smaller, more frequent meals, offering foods that required minimal effort, like smoothies, mashed potatoes, and soft, nutrient-rich broths, that she found some solace in her final months. These comforting meals didn't necessarily slow the decline, but they gave her something to enjoy without pushing her too hard. They allowed her to feel a sense of comfort and dignity, even as her body continued to change in ways that were beyond anyone's control. In the end, the most important lesson we learned from this experience wasn't about food or weight, it was about listening to the body and acknowledging the process of transition. Sometimes, our loved ones' bodies speak to us in subtle ways, and when we learn to recognize and accept these signals, we can ensure that their final days are filled with peace, comfort, and love. The subtle yet significant weight loss in elderly loved ones often serves as a warning sign that the body is beginning to shut down, and the natural processes of aging have accelerated. While families often rush to fix the issue by offering more food, this approach overlooks the deeper issue of nutrient absorption and muscle wasting. What is needed during this time is not just an increase in food intake, but a shift toward comforting, easy-to-eat meals, proper hydration, and above all, understanding. As a caregiver or loved one, it's crucial to recognize that weight loss in this context isn't a battle you can win by force. It's a natural part of the body's journey, and embracing this process with empathy and compassion can make all the difference in ensuring your loved one feels cared for and dignified until the very end. Sign 2: Extreme fatigue and weakness. Persistent fatigue that does not improve with rest is a clear and concerning sign that the body is preparing for its final stages. This is not just the typical tiredness after a long day, it is a profound exhaustion that makes even the simplest tasks feel overwhelming. Simple activities, such as getting out of bed, walking across the room, or even holding a conversation, can become monumental challenges. This is not merely the result of aging, it's a sign that the body is shifting its energy to focus on vital, life-sustaining functions. As I've observed over the years, aging causes a natural decline in the functioning of vital organs. The heart pumps less efficiently, circulation weakens, and the body redirects energy from less essential tasks to preserve the most crucial functions, such as breathing and maintaining blood flow to vital organs. This causes a significant drop in energy levels, leading to exhaustion and a lack of strength for daily activities. Another key factor is the slowing of metabolism. When the body is preparing for the final phase of life, energy is reserved for survival, rather than movement or interaction. This means someone in their final months may sleep more, take longer naps during the day, and struggle to stay awake for long periods. Some elderly individuals even experience sudden energy drops, where they seem fine one moment, but completely drained the next. What makes this particularly heartbreaking is the emotional toll it takes on both the individual and their loved ones. Many seniors, who were once independent and active, begin to feel frustrated or even embarrassed that they can't do what they used to. This can lead to emotional withdrawal, where they stop engaging with others because they simply don't have the energy. As a result, they become more isolated, which only accelerates their physical decline. I remember one case with an elderly woman who had been an active walker throughout her life. By the time she reached her late 80s, she could barely walk across the room without feeling winded. Her family believed it was just part of getting old and encouraged her to keep walking as much as possible. However, it soon became evident that her body was unable to keep up with those expectations. The best thing her family could have done was to create moments of peace, where she didn't feel pressure to do anything but rest. Eventually, the family stopped pushing her and simply spent time sitting with her, sharing stories and allowing her to relax without expectations. This gave her comfort in her final months. Weakness in the elderly is not just a normal part of aging, it's a signal that the body is losing its strength in vital areas. When the body no longer has the energy to maintain its daily functions, the muscles weaken, making movement more difficult. This kind of weakness doesn't just affect physical movement, it can increase the risk of falls, accidents, and other complications. Beyond that, fatigue and weakness can often lead to feelings of emotional isolation. Many seniors, who were once involved in community activities or engaged with family and friends, begin to withdraw from social interactions. They feel as though they don't have the strength to participate in conversations or physical activities, and as a result, they may isolate themselves. This can create a cycle where they become increasingly withdrawn, exacerbating their physical and emotional decline. I had a patient, a woman in her early 90s, who had always been a vibrant and active member of her community. Toward the end of her life, she stopped participating in any social activities and often declined invitations to family gatherings. Her family was heartbroken and assumed that she was simply becoming antisocial. However, after speaking with her, I explained that this withdrawal was not intentional, but rather a result of her physical exhaustion. Her body simply didn't have the energy to engage anymore. With that understanding, her family began to change their approach. Rather than pushing her to go out or join social events, they spent quality time with her at home, talking, watching movies, and creating a peaceful environment. This approach allowed her to feel loved and cared for, even when she could no longer actively participate in life the way she had before. Understanding the profound fatigue and weakness that accompanies the final stages of life allows us to adjust our approach. Instead of pushing for more activity or exertion, we focus on providing comfort and support, ensuring that every moment spent together is filled with care and compassion. By embracing these changes with empathy, we can help our loved ones feel valued and cherished as they prepare for their final journey. Sign 3: Cognitive confusion and withdrawal. As someone approaches the final stage of life, cognitive confusion is one of the most noticeable signs. It's heartbreaking to see a loved one who was once sharp and engaged begin to forget things, struggle to follow conversations, or lose their sense of direction in familiar places. These cognitive changes are not just a result of aging but are often a consequence of the brain's reduced ability to process information due to diminishing oxygen and nutrient flow as circulation weakens. This cognitive decline can happen gradually, sometimes over months or even a full year, before more noticeable signs appear. In some cases, the individual may begin repeating themselves, forgetting names, or losing track of time. They might even have moments of lucidity followed by episodes of confusion, as if their mind is fading in and out. I recall a patient, an elderly gentleman who had been a lively conversationalist his entire life. In his final months, he began to forget even the names of close family members. He would become confused in familiar settings, and sometimes he'd call his children by the wrong names. His family initially felt frustrated and saddened by this, not understanding the underlying cause. I explained to them that this wasn't just a sign of aging but a sign that his brain function was deteriorating. They started to adjust their expectations, focusing on quality time together, even when conversations became more difficult. They shared old memories, looked through photo albums, and spent quiet moments in his company. Despite his cognitive decline, he still felt the comfort of his family's love. As cognitive function begins to decline, many elderly individuals also experience emotional withdrawal. This is not a sign that they don't care about their loved ones, rather, it's the brain's way of shutting down emotional processes. Conversations may become exhausting, loud environments may feel overwhelming, and social interactions may seem too taxing. In the final stages of life, many individuals retreat into their own world, where they feel more comfortable, but may not engage as they once did. This emotional withdrawal can lead to mood changes, too. Some individuals become more irritable, anxious, or easily frustrated. Others might appear unusually calm or indifferent, which can be alarming for family members. It's important to remember that this is not a personality shift, but a natural part of the decline of brain function. The body and mind are no longer processing emotions in the same way they did earlier in life. I worked with a woman who had been a deeply social person her whole life. In her final months, she began to withdraw from family gatherings and even stop speaking during meals. Her children were confused and saddened by her behavior. However, after speaking with them and observing her, I explained that this was a common sign of brain function slowing down. Instead of pushing her to engage, the family began to simply be with her, sitting in silence or reading aloud from her favorite books. This allowed her to feel the warmth of her loved one's presence without overwhelming her, and it provided a sense of comfort in her final days. When a loved one begins to exhibit signs of cognitive confusion and emotional withdrawal, it's important to recognize that these are not intentional behaviors but are often signs of the body and mind preparing for the final stage of life. Rather than trying to force them into conversations or social situations, it's better to meet them where they are, offering gentle reassurance, and creating an environment that feels safe and familiar. Even if the individual can no longer respond the way they once did, they can still feel love, comfort, and peace. These moments of quiet connection often become the most meaningful during the final phase of life. Sign 4. Frequent infections and slow healing. As the body ages, its immune system weakens, making the elderly more vulnerable to infections. What used to be minor illnesses like a cold or a small cut can now become more frequent and severe. These infections may take longer to heal, or may recur more often than in younger years. For many elderly individuals, something as simple as a common cold or urinary tract infection, UTI, can lead to complications that they might not have experienced earlier in life. The body's ability to fight off bacteria and viruses decreases as circulation slows and organ function diminishes. The immune response is no longer as efficient as it once was, and as a result, the body struggles to clear infections or heal wounds. For instance, infections that once would have been fought off in a matter of days can now linger for weeks, or even return multiple times. Chronic wounds are another major concern. When elderly individuals develop cuts or bruises, the body's reduced ability to circulate blood and deliver oxygen to the tissues results in slower healing times. Pressure sores or wounds, especially in those with limited mobility, can become serious health risks if not carefully managed. These wounds may not only take longer to heal, but they can also lead to deeper complications like infections that resist typical treatments. I once cared for an elderly man in his late 80s who had a simple cut on his leg, but it took nearly 2 months to heal. This small wound, which would have healed quickly in his youth, refused to close, and eventually led to a more serious infection. At first, his family believed it was simply a minor issue, but as the wound worsened, it became clear that his body could no longer heal the way it used to. His family was torn between seeking more medical interventions and recognizing the need to focus on comfort and ease. In the end, we shifted our focus to keeping him comfortable, maintaining hydration, and managing pain, and this allowed his final months to be more peaceful and dignified. The emotional toll of repeated infections can be significant for both the individual and their family. Many elderly people, who once had a strong immune system, may now feel embarrassed or frustrated by their declining health. Families often find themselves caught in a difficult dilemma: should they push for more treatment, hoping for a recovery, or focus on ensuring their loved ones' comfort as their bodies begin to shut down. In these moments, it's essential to recognize that aggressive treatments might not be the answer. Pushing for more rounds of antibiotics or extended hospital stays can sometimes prolong discomfort without truly improving the person's quality of life. The focus should shift toward creating comfort, maintaining good hydration, ensuring their environment is calm and peaceful, and offering them moments of emotional connection and love. Sign 5. Major changes in breathing or circulation. One of the most noticeable and profound signs that the body is preparing for its final stage is a change in breathing patterns. You might notice that your loved one begins to breathe more slowly, or their breathing may become more shallow and irregular. These changes can occur gradually and are often linked to respiratory function decline. The breathing may become more labored or irregular, with periods of shortness of breath, even when they are doing minimal activity. Some people experience a rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths followed by long pauses. This is a natural part of the body's process of shutting down, as it shifts its energy to the most vital organs, such as the heart and brain. The lungs, which are no longer as efficient, start to struggle to keep up with the demands of the body. For families, it can be extremely difficult to witness someone they love struggle with their breathing. It's tempting to intervene or try to fix the situation by encouraging them to take deeper breaths. However, it's important to recognize that, in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make the person more comfortable. This can include keeping the room cool, using a humidifier, or offering small sips of water to help with dryness in the throat. I had a patient, a woman in her late 80s, who had been a lifelong non-smoker and had no major respiratory issues in her earlier years. As she approached her final months, however, her breathing became increasingly irregular. She would occasionally stop breathing for several seconds, then take rapid, shallow breaths. Her family was initially alarmed, thinking that something was terribly wrong. However, after explaining the process to them, they understood that this was a natural part of the dying process. Instead of rushing her to the hospital or trying to force her to breathe deeply, we focused on keeping her comfortable, providing her with a reassurance of family, and letting her breathe naturally. Her family came to terms with the situation and were able to spend her last days in peace, knowing they had given her the best care possible. Alongside changes in breathing, you might also notice significant changes in circulation. As the body prepares for death, circulation to the extremities, such as the hands, feet, and even the nose and ears, is reduced. You may notice that these areas become cold to the touch and take on a pale or bluish tint. This is because the body is prioritizing blood flow to vital organs, like the heart and brain, and reducing circulation to less critical areas. This can be unsettling for families to witness, as it might seem as though their loved one is becoming more lifeless. However, it is important to understand that this is part of the body's natural process of slowing down. The heart is no longer pumping as strongly as it did before, and the body is conserving energy for its most essential functions. In some cases, fluid can build up in the lungs, making it even more difficult for the person to breathe. This can cause a gurgling sound when they breathe, or they might feel tightness in the chest. These symptoms are often mistaken for congestion from a cold, but in elderly individuals nearing the end of life, this is often a sign of lung weakness. I had a patient who, in the final weeks of her life, began to feel short of breath even when sitting or speaking. Her family was very worried and kept asking if they should call for an ambulance. After explaining the situation, I reassured them that this was simply the body's way of preparing for its final stage. Instead of forcing her to take deep breaths or panicking, her family focused on making her comfortable, using pillows to prop her up and making sure the room was cool and calm. These simple steps made a significant difference in her comfort and allowed her to feel more at ease. The changes in breathing and circulation are often some of the most visible and difficult signs to witness as a loved one approaches the final stage of life. Breathing becomes more irregular, and circulation slows, which can cause discomfort or concern. However, it is crucial to recognize that these are natural processes and are not something to fix, but rather something to support. During this time, the focus should shift from medical intervention to comfort care. Creating a peaceful environment, offering emotional support, and addressing physical discomfort in the most compassionate way are the best actions to take. Even when physical symptoms become more pronounced, love, companionship, and presence can help ease the transition, making it as peaceful and dignified as possible for your loved one. So, these signs aren't just typical signs of aging. They are messages from the body, silent warnings that, if we know how to listen, can change the way we prepare for the final stage of life. Recognizing these signs early doesn't just allow us to provide better care, it also brings peace of mind for both ourselves and our loved ones. The remaining time can be spent on meaningful moments filled with love and connection, rather than unnecessary worry. While we can't avoid the inevitable, we can make it more meaningful, filled with respect, peace, and comfort. Remember, the final moments of life aren't just about what we do for our loved ones, they are about how much they feel loved and cared for. If this video helped you realize something important, please share your story with us. Together, we can learn and support each other through these challenges, making each moment count. Thank you for watching. Don't forget to subscribe to the channel for more insightful content and turn on the notification bell so you don't miss the next video.